Hello, this is Dr. Haddad, the Chief of Staff of Water Health. Hope you're doing well and staying safe. So far, so good within the hospital. Our bed occupancy and capacity continues to be in the green. Our clinical operations are proceeding as per normal. We did not have to slow down or cancel any elective cases. If you're not feeling well and you need urgent medical attention, then please don't hesitate to seek our help in our emergency department. The hospital continues to be extremely safe and clean and open 24/7 to help you. In the meantime, we've noticed an increase in COVID-19 cases within our community, about 40 this weekend alone. This is most unusual given that we've been doing so well as a community for the past few months. We've been in a bit of a bubble and avoided the massive increase of COVID cases in the province so far. Having said this, we seem to be affected now. I'm quite confident that all of us will come together, as we have been for the past few months, to reduce the viral load and viral spread within our community. Please do your best to follow public health measures by avoiding crowds, avoiding holiday parties and gatherings, physical distancing, washing your hands as much as possible, and wear a mask indoor in public places. Avoid non-essential trips and reduce your social interactions. As a hospital, we've been preparing for a second wave of this pandemic for many months. We have adequate supplies and staffing. Having said this, we need your help. The more COVID cases in the community eventually will translate to more COVID patients within the hospital. This eventually could displace care to non-COVID patients who need our attention. As you know, healthcare resources are limited. Let's do our best to keep Sarnia-Lambton in the green and keep our hospital operating as normal as possible. In the meantime, our hospital is part of the whole provincial network of healthcare institutions. We might be called upon to help our neighboring counties and cities in case they need our help, and we are ready for that. As for the vaccines, the vaccine rollout in the province will follow a formula of who will get it and where. The who is, it'll start with high-risk populations, residents of long-term care facilities, people at risk of high mortality or poor outcomes with the virus will get it first, followed by the formula of where, which will be hot zones all the way down to low prevalence zones. So I don't think we will be in the first wave of getting the vaccine, given that the prevalence of COVID-19 in our community and hospital is much lower than other areas of the province, such as Toronto or Windsor. Nevertheless, we are ready for it. We have the freezers for it, and we're working very closely with our public health unit and partners in the community to roll out the vaccine whenever it's available to us. Having said this, vaccinations, albeit extremely important and gives us a glimmer of hope that this pandemic one day will be behind us, will still take a few months to achieve its goal. In the meantime, this winter will be long. We have to do our best to mitigate risk and continue to keep COVID-19 at bay. So please continue to avoid crowds, only do essential trips, physical distancing indoors, masks indoors in public places, and wash your hands as much as possible. As we go into the holiday season, I know this year is different. Unfortunately, all of us will not be enjoying the company of our friends and families, but this is a necessity so all of us can survive the next few months until vaccination can do its job to protect all of us. I wish you all the best for the Christmas and New Year season and for all the holidays. Happy Hanukkah, Merry Christmas, Happy New Year. I'm quite certain and confident that next Christmas and next year will be much better than this year. Stay safe, and thank you for all you do to keep Sarnia-Lambton safe.